Welcome to Health Strategy TV. Today I'm joined by James Thomas, who is Director of ICT of UCL Hospitals. Welcome, James.
Thank you.
How do you go about choosing the right partners for outsourcing?
Some of them we've inherited, some of them we've chosen. So our primary relationship for our main IT outsourcing, this was contractually already in place, and we have gone through a process of evolving how they relate to us, and that's a constant exercise. You must work at it. You know, my background's not NHS prior, only for the last sort of 6-7 years. Prior to that was very much commercial, Oracle, oil, water industry, and having been on the supplier side, I know that you need to strive for a win-win situation. So the ones that we've inherited, we've educated to try and make sure we have a shared vision and shared benefit from it. From Unified Communications, very much we've been able to select a partner there, and so for that we were absolutely after, you know, vision and benefits and values in the way in which they work. Those were far more important to us really than had they done it before in particularly health, etc. So our, you know, Azuri, our Unified Communications partner, absolutely has worked out brilliantly because they have the ability to be innovative, they have the ability to flex and see the vision of where we're striving for. So it's much better when you can choose, but also you can take existing providers on a journey if you're clear and consistent about how you articulate.
And are they willing to adapt? Have they responded to that journey?
Yes, yes, most definitely. I mean, Logica were a subcontractor at the start of this to GE, and that was a very particular type of behaviours, you know, optimising margin as a subcontractor, etc. Whereas now they are a prime contractor to the trust and have been for the last 5 years. And as a result of that, we've changed completely the account engagement, the positioning within Logica, and we've, you know, to the point now we have mini board-to-board meetings with our board and Logica's board to reiterate how important they are to us achieving our success, but equally how important we can be for them in articulating joint success, and that actually enabling them to, you know, publicise their success and capability. So, but you have to invest in it. It's one of those things that, you know, have to invest in. From my perspective, I'm very lucky. From my board all the way down, we absolutely understand how important these partners are to us and how they deliver through and with us.
Many commercial companies will have a commercial offering. They'll think that they have the solution to the challenges within the NHS, and that's their offer. What's your view of that position, and do you think that companies actually need to work more in concert with people like yourself? And how do they do that within a difficult procurement environment?
There's several bits there which are a challenge. Procurement most definitely is a challenge. The having an offering and putting it into the market, I think there absolutely needs to be a recognition that the NHS is so diverse and big that organisations are at complete different levels of maturity. And if they want to take an approach where they have an offering, then they need to almost stratify the NHS and work out which organisations have either the immaturity or the maturity to take that offering as they have it. Otherwise, then they need to be far more intelligent about understanding the journeys organisations need to take, where they are on that journey, and therefore what value they add to helping those organisations take those journeys. That's very, very difficult when you look at the world of how we can procure, the public sector procurement, the ODU, etc., and everything else, and that's quite constraining. And one of the other roles I do, I sit on the steering board for LPP, which is the London Procurement Programme, which is the hub for procurement for NHS across London. And some of the work we do there is trying to work with what frameworks actually need to be in place, what frameworks can we take from elsewhere in the government, public sector or central government and cabinet. And a lot of that's coming out. I think there's a real move towards services rather than specific offerings. And that will challenge the procurement, but I think the procurement will evolve to permit that to happen. But it's a very complicated field. I think the how could we help, come and talk, you know, that absolutely, there is a lot of knowledge and information about the business needs and the business or trust journeys that are being taken. And I think it's the clinical strategies and the patient care strategies that organisations are aspiring to deliver. Those are what need to be understood, and once you've understood those, then it's much easier to understand how you can add value to that.
Changing just tack for one final question, and that's the Healthcare Strategy Forum. What do you think of this kind of format and the opportunities for people like yourself, senior decision makers within the NHS, to engage with providers?
This was unknown to me really prior to the request to come and speak, etc. And I guess I came with no preconceptions of it. Actually, it's been a really, really productive 2 days, and it's interesting because I've been to other events where you have non-industry specific, but big collection of CIOs or IT directors and a big collection of suppliers, and you get value out of those. But actually having the subtlety of it being an industry specific, the conversation in the coffees and the bars and everything else as well, everything is about the industry. So you get there's an added level of value out of it. So I've found it extremely productive. I've found certain suppliers that I had preconceptions over what they were doing, and they've moved forward quite significantly as well. I've certainly been able to impart a lot of information outside of just the presentations to a lot of other organisations which are taking the same journey and are at different points at it. So yeah, having no idea what it would be like, I found it very useful.
Is there anything else that you haven't said that you would like to add?
I think the other thing I would say is anything like this, the more that it can help to actually motivate people to continue the challenges that they're faced against, I think that's great. It's a really, really difficult environment to expedite transformation and change. And at the end of the day, this whole agenda has to be about transformation, otherwise why are we doing it? And if people don't stay motivated and they don't have the opportunity to see that there is the opportunity to succeed and make a difference in these things, they'll run out of energy. So I think anything you can do to etch that into your presentations as well, I think that would be a real advantage as well.